India has now surpassed Brazil in terms of the number of coronavirus cases, even as the cases now surpassing the 42 lakh mark. What does it mean for India? How is India bracing up to deal with the COVID-19 infections? Joining us on ET now is the director of AIIMS, Dr. Randeep Guleria, in conversation with us. Sir, appreciate you taking your time out and speaking to us at ET now. This is Ruchi Bhatia. Let me first begin by asking you about the numbers itself. India now surpassing Brazil in terms of the number of COVID cases at close to 42 lakh. And scientists at this point of time, sir, believe that the epidemic in India is now at a stage where government intervention is unlikely to make any significant or substantial difference in the speed at which the number of new infections are being detected. Would you agree with that, sir?
So one thing that I would like to really highlight here is that the number of cases have gone up and we have a huge number of cases. But also if you were to look at number of cases per million population, then we are much lower down, even not in the top 5. And that's basically because our population is very large. And the population of India is equivalent to the population of many countries put together. So in absolute number, our numbers will always be high. But if we were to calculate number of positive people per million population, it's going to be in the lower side. Having said that, it's always a concern when you start having these large numbers of cases every day, because you're worried that this may have an impact on the healthcare system. There may be an increased burden on as far as hospitals are concerned. And therefore, there has to be an aggressive action both from the public and from all the other individuals, including policy makers, as to how do we prevent these numbers from rising and actually bring them down. From the public, I think the most important thing is that we've been now through this pandemic for almost 6 months, and people have had what I say is Covid behavior fatigue. People have started now getting a little fed up of the lockdown, of isolation, of having to wear a mask, of having to maintain physical distancing. And I think that is causing one problem. And therefore, if you go out in various cities, you will notice that people are not wearing masks. People have started crowding together, and it's as if there was no COVID pandemic going on when we're not having 80 to 90,000 cases per day. Secondly, we also need to now develop strategies of how do we manage cases both in smaller cities and in rural part of our country, because that is where now the pandemic is moving from larger cities or metros where it was there in the beginning. So this is the strategy that we will need to develop in terms of testing more there, tracking, treating, isolating these patients, and making sure that cluster doesn't develop out there, and we have aggressive containment zones also in small cities and in the rural part of India.
Sir, in fact, you've hit the nail on the head. The fact that you're saying that it is the fact that people are having some sort of a COVID behavior fatigue, and that is the reason that we're seeing high number of COVID cases. But given the fact that we have almost 75% of the 6 lakh cases coming in from the top 10 states alone. Look at states like Maharashtra accounting for almost 22% of all the cases. Andhra Pradesh consistently reporting high cases between 10,000 to about 11,000 new cases every day, even as the recovery rate there is slightly better. UP, Delhi, Jharkhand all reporting significant number of cases. And now we're at a stage we're not locking down our economy, we're unlocking, we're opening up. Metros are being run, the mass transport is being opened up in a big way. Do you see it as a major risk coming in, sir?
So you're right. We have to balance two things. One is preventing the spread of infection, and the second is looking at the economy and people's livelihood. And that is where the challenge of having COVID appropriate behavior is very, very important. As we open up and as the lockdown becomes sort of less and less, it is very important that individuals recognize their responsibility in terms of physical distancing, in terms of wearing a mask, in terms of hand sanitizing, and people who go to offices, working in factories, become more vigilant in terms of proper seating, proper movement, so that there is unidirectional movement, there is good ventilation, and there is a mechanism that anyone who has symptoms stays at home, and it's not compulsory for him to come to work, and his pay is not cut. and there is some monitoring for symptoms and fever for all people who come into work in an office or in a factory. So unless we do that, we will not be able to balance the two things that we're doing, that is opening up and having back to normal, but at the same time learning to live with COVID. If we have to live with COVID and have our economy back to normal, we will have to develop appropriate behavior strategies and strategies of how we contain the infection if there is a large cluster in any city or small area.
Right, you're saying that there is a need for appropriate COVID behavior strategy that needs to be put in place. But Dr. Guleria, given the fact that you've spoken about how there is a need to strategize and now look at how we can prevent the rise of COVID cases in rural areas, what are you telling the states in the meeting with them? How are you telling the government that there is a need to now focus on the rural economy and the rural areas also? Because in cities, we have been able to develop our medical infrastructure, but we may not have the same kind of facilities maybe in some certain village of UP.
So there are two things in this. One is that when we had the lockdown, a lot of effort was put by the government to really see that there is good facility, COVID care centers, COVID hospitals, and some degree of ICU care, even at a district level. So whether it be oxygen supply, whether it be beds, whether it be monitoring, and a network of e-consultation or teleconsultation would be developed, which is being done, and even AIIMS is part of that. But having said that, it has to be also something which is an ongoing activity, because as the cases increase in different areas, there has to be a process in place so that there is proper care given to all patients who come even in rural India. One advantage that we have as far as rural India is concerned is that unlike the cities where there is a lot of population density and crowding, in rural India there is still people who stay at distances, their houses are far apart, and chances of clusters developing are less. So if we are able to have proper education and people's behavior there is good, then the chances of a large spread happening in rural India are much lower than what we saw in urban slums or cities like Mumbai and Delhi.
Absolutely. Given the facts, we are seeing high number of COVID cases. We're currently at almost 42 lakhs. And even though you're saying that our population is huge, and that could be, and we're testing more, and that could be one of the reasons that we're seeing a high number of cases. Given the fact that we're now testing more, but we also have the economy opening up, do you see a higher surge of COVID cases and the possibility of India even taking up the top spot in the number of COVID cases?
So in absolute numbers, that can happen in time, that we may have in absolute numbers a much larger number of cases than what we're seeing right now, and this may increase for the next few days or weeks. But I think the important thing, like I've said, is that if you were to look at it as to the number of cases per million, then it is much less. Also, if we were to look at our recovery rate and our mortality, it is much better than what has been seen in the West. So we are in a better position in terms of people who have recovered, and in terms of our recovery rate. The numbers will be high, related, like you rightly said, to large testing, but also because our population is so large that in absolute numbers we will always look very big.
Dr. Guleria, now there are also concerns coming in on reinfections happening. In fact, Bengaluru has reported the first case of a reinfection. How big a risk do you think that is going to be, sir?
So there are now reports coming from different parts of the world of possible reinfection. We had this worry also in the beginning of the pandemic when we had reinfection being reported from South Korea. Then it was actually observed that this was not reinfection, but people who continued to shed the virus for weeks, and that was being looked at as reinfection. But there are definite reports of reinfection coming up. It's not a major problem right now because the numbers are very few. But as the pandemic progresses, and as we worry that the immunity may wane, this may become an issue both in terms of number of people who get infected, but also in terms of how effective the vaccine is. So therefore, this is something we need to follow closely over the next few months to see whether this is a small problem or this gradually with time becomes a bigger problem.
In India, there were also at one point of time we were talking about herd immunity. Where are we on that in your experience? And given the fact that now there are worries of reinfections coming in, could that also hamper the antibodies that were being developed in the general population at large?
Yes, so I think the important issue here is that when we talk of herd immunity, we're looking at least 50 to 60, maybe even 70% of the population getting infected and therefore having immunity and thereby not being able to transmit the disease and not getting the infection. And therefore, those who are susceptible don't get infected because everyone around them is protected and therefore the transmission chain is broken. But if your immunity comes down and you get reinfected, that means that even after having got infected and you can still have the infection and the whole theory of herd immunity may actually come down. So I think herd immunity is going to take some more time, even if you're going to achieve that. I don't see that happening over many months. If we have an effective vaccine, that may help in actually developing what we call herd immunity.
Before I let you go, I have to ask you about the vaccine as well, sir. Given the fact that WHO is also keeping a close eye on the developments on the vaccine front, there are also concerns that India is far behind in the race for procuring vaccines, even as the world is getting ready. The developed countries like US, UK are far ahead of India in terms of procuring a vaccine. How is the government, in your conversations with the government, how are you all bracing yourself for the procurement of vaccines, because for a large population like India, it's going to be very, very important?
So I think India is in a very good position because of multiple factors. One factor is that there are 3 vaccines, at least where the human trials are going on in India. We are in phase 2 and phase 3 trials as far as the vaccines are concerned. And these are 2 of them are Indian vaccines. So it's something that is made in India and we should be able to use them for our own population. Second is that in terms of production, 60% of the global vaccine production happens in India. We have a huge capacity to produce vaccines. And because of that, there is already a program in place where the manufacturing companies are actually going in for large-scale manufacturing plants, right from vaccine to the vials, to the caps, to the cold chain mechanism. And this is being worked up so that as soon as the vaccine is available, we will have enough stocks to be able to distribute it, and a plan in place of how to go about distributing it, and also a plan to how to prioritize who should get the vaccine. Because remember, once we have the vaccine, in the beginning we won't have all the doses that we need. The number of doses will gradually come up over a period of time. So we will have to have a priority list, and depending on the doses that we have, start giving it to those who are on the top of the list and work our way down. So all of that is already being done, and I'm sure that by the time the vaccine is ready, everything in terms of procurement, in terms of distribution, and in terms of who gets it first will be in place.
So before I let you go, this is going to be my last question. As the director of AIIMS, as somebody who's keeping a very close watch on the healthcare facilities here in the country as well, what is going to be your message to the people of the country as we're seeing the number of cases rising to almost 42 lakhs, and you're saying it is generally a fatigue in the behavior of people, and that is also leading to a high number of COVID cases. Your one critical message to the people of India?
So my message is simple. I would say that the fight with COVID-19 is still on. We're in the heart of the battle. And this fight is going to be won by the citizens of our country in not the hospitals, but in the public domain. And that is why for all of us, it's important to re-energize ourselves, to have good COVID appropriate behavior. Please wear your mask if you go out, even if you're in your office. Don't maintain physical distancing. Sanitize your hands, and if you're indoor, make sure there's good ventilation so that there is less chance of infection happening in an office. If we do that, I'm sure the cases will come down and we will be able to win this battle against COVID-19.